So thanks for the invitation. In Brazil is good morning. In Europe it is good afternoon. And I am Amelia Reis, as you said. I work in a University of São Paulo, and I need to show you the University of São Paulo Clinics Hospital Complex. This is the main building, and we have another building surrounding. And here is the institute, the Child Institute, the place that I work. Nowadays, in COVID time, all this main building is treating only COVID patients, and all the other buildings has to treat the patients who are COVID negative. So are you hearing me?
Yes.
Go ahead. Yes.
I will answer the questions from Ricardo based in this document. This is an institutional consensus for management of children and adolescents infected with SARS-CoV-2. It was prepared in my hospital, and this protocol is a continuous process and is updated every week or sooner if we have some relevant modifications to be done. My emergency department, the first question is, how is your pediatric emergency department organized? My emergency department is a tertiary care children academic hospital. Most of patients are children and adolescents with very severe underlying chronic disease. And they came to my emergency department when they have an acute problem. So we have a room for triage, 5 consultant rooms, 1 emergency room, 1 procedure room, 2 isolation rooms, and 1 lounge large enough to 9 to 15 beds, depending on the size of the patients. So the second question is, how can you define a suspected case of coronavirus infection? So it has been changed over time. At the beginning of the pandemic, we define a suspected case when we have respiratory symptoms with the fever. But as we have a lot of chronic diseases, during the time we changed the suspected cases to another situations, like fever in an immunosuppressed patient, like an oncologic neutropenic patient, respiratory symptoms, significant respiratory symptoms, even without fever in an immunosuppressed patient. And nowadays, we are testing coronavirus infection in young infant with fever without SARS. How can we manage the suspected patient in the emergency department? So the level of care depends on the patient's situation, because all of them has chronic diseases. So they have some symptoms because of the virus, and sometimes the underlying diseases is decompensated. So for a stable patient, suspected case is managed by a resident in one of the private room, in an isolation room. And this resident must wear protective personal equipment for droplets and contact contamination. And in my institution, we use regular face mask, glasses, gown, and gloves. If the patient has some kind of instability, he goes directly to the emergency room, and all the professionals must wear PPE for aerosol contamination. We try to keep as less as possible the number of professionals inside the emergency room, but as we are an academic institution, it's hard to keep a very few patients inside. We almost treat the emergency patients with 5 to 6, sometimes 7 personals. And in this situation, in emergency situation, we use full protection. And in my hospital, we have this kind of protection until now. I don't know if it will be enough until the end of the pandemic, but until now we have all of them. 95 face mask, glasses, face shields, gun, gloves, and cap. Relating to the treatment of the patient, we investigate the coronavirus, the PCR for SARS-CoV-2 in nasopharyngeal swab. And all these patients, we also investigate other viral situation, because nowadays here in Brazil, it's the time for syncytial respiratory virus, and we are beginning the influenza time also. So we have a mix of virus at that time. The blood tests we ask is according to the patient situation. We ask, it will depend because of the underlying disease. We perform chest X-ray for all of them. We perform point of care lung ultrasound, all of them with the respiratory symptoms, because it's we have a research protocol running at this moment, so we are using that in this kind of patients. Chest CT scan we do only for very special cases, because to avoid the radiation and everything. About the treatment, for children here in my institution, we aren't using any specific medication against novel coronavirus, like antivirals, like hydroxychloroquine or something like that. No, we do not use. We do standard treatment for respiratory disease, as we've been done in other situations. And also standard treatment for the basic conditions. So nothing so special, nothing so different when we have another kind of SARS. Which criteria do you use to define a coronavirus infected patient? So we use the PCR positive for SARS. That's our case is defined. For patients, health, suspected or infected, do you have a separate path in pediatric emergency department? I would say yes, but I'm not so sure, and I will tell you why I'm not so sure. When a patient came to the emergency department, and if he or she has respiratory symptoms, he or she receives a mask and go to the triage. And after the severity score, the patient is sent to some different levels of care. He can be sent to a primary care. He can be sent to to be examined in a regular room if he doesn't have any respiratory symptoms. He can be sent to be examined in an isolated room if he has respiratory symptoms, and depends on the condition, he goes directly to the emergency room. Patients who are discharged after this first evaluation, patients who are not discharged after this first evaluation are kept in the emergency department until we have PCR results. And our PCR results most of the time is taken 12 to 24 hours to be read. In our emergency department, we have 4 private rooms appropriate to isolate these patients. So if we have 4 or fewer patients, each one will be led in one room. But if we have more than 4 suspected patients, they all are all allocated in the same large lounge. So here we have a problem because we didn't have the results, and some of them will be positive and other will be negative. So when we have many suspected patients in the larger lounge, we take some precautions. 1.5 meters distance between beds. Professionals must wear PPE and change gown and gloves every time they see one patient. And of course, they have to wash hands many times. When we have the test positive, so infected patients, the follow-up orientation to infected patients who are discharged is provided by emergency department physicians via telemedicine. We follow the evolution of these children. Every patient positive to SARS who needs hospitalization is transferred to the main building, as I told you before. So the children are here in this child institute, and if he is positive and must be hospitalized, he is transferred to this main building, and this building is treating all COVID patients, no matter it is neonatal, child, adolescents, and adults. Everyone are kept here. The 6th one, do you have a program to screening for caregivers? We don't have an active program, but when we have a positive case, we ask for the caregivers and the parents if some of them have some symptoms. And the guidance for suspected caregivers or parents is to go to the closest public care house of their residence. This last slide, I show you the picture. We have until now in our emergency department 7 cases. We have more, but not in emergency department. As you can see, most of them have chronic diseases. We have 1 fever without sources in a baby with 13 days of life. He came to the emergency department only when fever, and the 2nd days he has a bronchiolitis symptoms, and he was positive. We have 1 death, but it was a very severe baby with the Edwards syndrome, and a lot of comorbidities. He developed SARS and that. Nowadays, we have 1 and 2 in ICU. 1 is intubated, and the others on ER. The symptoms, most of them came to our department with the kinds of SARS, insufficiency respiratory, and this last one only have fever during the dialysis procedure.
Oi, Amélia, desculpa, não dá para ver as slides. Pode colocar de volta, por favor?
Can you see now?
Não?
No, Amelia.
Qual? Agora parou de
Parou alguns minutos atrás. Se você pode mandar de volta a apresentação, por favor.
Let's see again.
Okay, Amelia, do not worry. Go ahead for the 4 minutes. Go ahead, no problem.
Are you seeing now? I
No.
didn't do anything differently.
No. Anyway, it's no problem without presentation. Go ahead just for
Okay,
the last question.
I finished.
Do you
I
have
feel-
finished, Amelia?
How?
Yes, okay. Thank you, Amelia.
Sorry if you didn't see the slides.
Ok, va bene. Io volevo... ok.
Di ad Amelia se ci manda le slide.
Volevo... Amelia, can you mail your presentation by mail or...
Yes.
Ok, go ahead. Io direi di andare avanti a questo punto.